Hello everyone. This is a case of left side complete cleft lip and we have operated with Millard Rotation-Advancement flap. You can see the markings on the cleft side as well as the lateral side. These are very important to plan the incisions accordingly. And here we have marked the philtrum, and after the incisions are done, you can see the flaps are being raised. So the flap is currently being raised in the floor of nose, and we are trying to put a suture in the columellar area to make the columella thinner. There is a widened columella as well as flattened ala in the left side. We have removed a small triangular piece of tissue from the floor of nose so as to reduce the width of the nasal floor. Now the rotation advancement flap will be done. Here we can see the depth of the columella is less. We are releasing the Orbicularis oris muscle from the flap skin, and now we are closing the Orbicularis oris muscle by intermuscular sutures. This will bring the two sides of the cleft together. Carefully planning the incision is most important so as to avoid the overlapping as well as for a perfect rotation and advancement of the flaps. So this incision was already marked in the initiation of the surgery. We have taken out a small piece of tissue from there. Plastic surgery is a work of common sense also. While doing surgery, if you see that there is some redundant tissue, you have to cut it accordingly. But the most important thing is that to avoid excessive removal of tissue, because it is very precious. Once you have cut, you will not be able to get it back. So before cutting, you have to just think what has to be done. So here we can see apposition is almost there. We are now closing giving the final skin sutures, and you can see the drooping ala of the nose. Since the child is only 14 months old, we are not going to do a primary rhinoplasty here. Only we are giving some sutures in the columella to make it stiff, and over time when the child breathes, the size of ala and the anterior nares will be opening a bit much, but when the child grows in age, we can later on do a rhinoplasty. We can see the inner surface, and this is how we finish the case. We used loops for doing this closure. Thank you so much.